topic, which is pediatric fractures. I'm going to make this topic super easy. We're going to start it right off with an anatomy lesson, specifically pediatric bones. So we're going to start with the periosteum. The key difference between pediatric bone and adult bone is actually the thickness of the periosteum. This thick periosteum actually allows them to heal faster, and that's why peds patients do so well in the healing process. That is fractures versus surgery, they do great. Here's a sketch of a long bone, like for example your tibia or your fibula, and it is broken down into 3 different parts. We've got the epiphysis, metaphysis, and diaphysis. In between the epiphysis and metaphysis is something called the physes, or the E-plate, E-line, or growth plate in simple terms. We're going to zoom into this area and we're going to talk about the 3 different phases of how these chondrocytes are developed, aka also known as the cartilage cells. So the first step is growth. At this stage, it's pretty much they're resting, they're dividing, and they're forming into little columns. I like to think of this phase as the Netflix and chill group. Now the second phase, this one is where they're maturing. This is where the chondrocytes will start to increase in size. We call this hypertrophy. And they'll start to calcify. That's the result. You can think of the Netflix and chill and getting pregnant and growing a baby. Don't ask me where I come up with these examples, but you'll never forget them now. The last phase is transfer. And this is where you're going to add the vascular system. And the cartilage is going to start to ossify, so it's starting to get hard. And that's it. That's the 3 different phases. I like to also highlight the first letter of each of these phases so they stand out. So we've got the G, M, T, growth, maturation, and transfer. And that's all occurring in the physis or the growth plate. Now I'm going to pull up a picture here. This picture is showing you when the growth plate is open. And it's really important to see an x-ray of this. It tends to be a high-yield topic. They'll like to show you a picture and be like, hey, is that a fracture? And you're like, no, it's most likely you'll see one on the top and the bottom on whatever x-ray you're looking at, and it's most likely a growth plate. So watch for that. Here's another x-ray of the growth plate officially closed. So it's actually a radio dense line. So it's going to be a bright white line. It's not a fracture, because a fracture would be more of a black line. It is a closed growth plate. Now let's talk about something called bone formation. And bone formation is also divided into 3 different categories. The first category is going to be the intramembranous bone formation. So these bone formations are different ways that bones in our body try to form. So the intramembranous is usually flat bones. An example would be the sternum. And this is when the osteoblast produces bone within the connective tissue. Towards the end, I'll have pictures for all of them. The second one is the endochondral ossification. This is what long bones do, like tibia and the fibula. And this is where the cartilage is replaced with bone. And then here's a picture showing that, and eventually how it's first cartilage, which you notice most babies are cartilage when they're born, and eventually that cartilage is going to be replaced with hard ossified bone. There's also 2 ossification centers. You've got the primary one and a secondary one. Primary is usually at the central portion, and the secondary is at the very ends of the bones. And now I'm going to pull up a picture here for the intramembranous bone formation. This is how it's, bone forming within this, all that connective tissue. So So now we did the bone formation. We talked about the phases of the bone, the chondrocyte growth. Now let's get into the cells of the bone. Okay, so the first type is the osteoclast. I think of C for killing or breaking bone. Their job is to break bone. Osteoblast, B for building bone. So they're the ones that are going to create the matrix of the bone. Then we have the osteocytes. These are the mature bone cells. These are osteoblasts. They're actually trapped in the matrix and they form the compact bone. So it's kind of like the next phase of osteoblast. Then we have the osteoprogenitor cells, or abbreviated OPG. These ones actually they're already programmed to become osteoblast, and they're actually found on the periosteum. You can think of them as the OPG likes to live on the edge, which is the periosteum. Again, gotta have this amazing picture. It looks very busy, but it puts everything together when it comes to bones. Kind of reminds me of a donut. So I'm going to randomly stick a picture of a donut because you gotta make you guys all hungry. Now that we've kind of reviewed the anatomy and the different parts of a bone, let's get into the high yield topic, which they love is classification systems. And we're going to start with the one and only Salter-Harris classification. And with this classification, you know, I got to have some sort of acronym to make it very easy on us. So here's more of a cartoon picture of it, and then I'm going to show you an easy way to draw it out that you'll never forget. So the acronym for this one is going to be SMACK. S-M-A-C-K. You can think of it, sometimes you like to smack your kids because they drive you crazy. Just kidding. And then the second part after the SMACK, because this is a very long classification, you've got R-E-M-D. So now I'm going to draw it out in more of an easier, faster way that I've created, where you can just do a quick sketch of it right before you're taking the test, and then you'll never forget it. So you're going to draw the fibula, and then you're going to draw the tibia. Make sure the growth plate is open in this diagram, since we're talking about pediatric fractures here. And honestly, draw it out a couple times and it'll be easy breezy. So line 1 is going to be pointing at the growth plate. Line 2 is going to be a line going into the metaphysis. Then you have line 3, which is going to be going into the epiphysis. 4, we're going to stick it on the side. We'll talk about it in a second. On 5, make sure you draw those arrows and then put a 5 next to it. And then we have 6, which is going to be the medial corner along that metaphysis. And then we have 7, which is actually the whole epiphysis. Then we have 8, which is going to be midshaft, and 9 is going to be into the diaphysis. So now we're going to add words to all these things, so it makes more sense. So for Salter-Harris 1, this is also known as the S in SMACK, or separation. Sometimes you'll notice a little bit like a goose egg swelling on the side. The great thing about this one, the growth plate and the top and the bottoms may separate a little bit, but it heals really good once you put them in, reduce them and splint them for about 4 to 6 weeks. They do really well. So then we have Salter-Harris number 2. Also, the M in SMACK is metaphysis. This is the most common one. Remember, the periosteum is still intact for this one. The high yield thing is talking about the sign, the Thurston-Holland sign, which is this little, a Thurston-Holland, I think of some sort of Christmas tree, like a right angle, like a corner. Don't forget it, because they love it. Then we have number 3, which is the A, the articular, the epiphysis area. This one is quite common in older kids. Then we have C, which is the or number 4 is a C in SMAC, complete. So this is a combination of 2 and 3. It does have a rotational component. Do not forget that. It's triplanar. They love that question. You're going to fix it, so you're going to have to use a smooth K-wire. So this way, if you don't put any, threads and a screw in there, you won't cause any growth arrest. So make sure you do not forget that number 4. Then moving on to number 5. This is going to be the K in SMAC. This is also crushed with the K. This is also a high chance of limb length discrepancy and compensation because you're really just smacking those 2 ends of the growth plate together. Then we have number 6, which is the R, or wrangle. And this is occurring at the node of Ranvier, which I will, gotta have a picture because it will not make sense if we don't dive into a little deeper what this node of Ranvier is. So here's a diagram of node of Ranvier. So right above the metaphysis, and you've got these little columns of the chondrocytes, and its job in this area is to make sure this process runs in harmony, so they're all aligned, well in order. So let's zoom out on that picture and let's focus on number 7. So this one is the one that's officially in the epiphysis. It's also called, so the E stands for epiphysis, but it's also called Ogden 1, and it's known to be the true epiphysis type of fracture. Again, another one that they like to, kind of like a buzzword that they like to use, the true epiphysis fracture. Then let's move to number 8, Ogden number 2, also known as the M in REMDE. It's the metaphysis where you find a fracture. Then you have Ogden 3, which is where the diaphysis has a fracture. And there you go, you've got SMAC, SMACKREMD. Hopefully that really simplified it. I know it can be overwhelming. There's tons of classifications out there that we have to all memorize for boards and things like that. But another thing that you should know is how do you manage them. I think that's more of a high yield too, which we kind of briefly talked about when we're going through each category. But just to reiterate it, the Salter-Harris 1 and 2, those are closed reduced. You use a casting or splinting for a couple weeks to let it heal. Just be careful when you are close reducing it. You'll notice that the periosteum can kind of get in your way. Or if something's holding you up, it's probably the periosteum. Then we've got Salter-Harris 3 and 4. Those are the ones that are going to be ORAF, right? Avoid anything crossing the epiphysis, so smooth K-wires are your best friends on that one. And again, kids do great in healing. So then the Salter-Harris 5, that's the high chance that you're going to have some sort of growth arrest, and it affects it pretty bad. That's it, you guys. We did it. Another topic down. Until next time, go study hard, and hopefully this helped a lot. See ya. Bye.
I hope you guys enjoyed today's video. If you did, be sure to give it a thumbs up. And if you have any suggestions on other podiatry related topics I should go over next, leave a comment below or visit the website. Dr. CB signing off. We'll see you in the next video. Bye.